Good morning. It's Silver Monday at Jay's Breakfast Club. Yay! Well, once again, we have made that decision to follow the guidelines of our health professionals, and those of you at home, we want you to stay home and be safe. However, if you want breakfast, please call in and we can do this. Chelsea, I need the commercial. We can get your breakfast to you while you are getting all of this valuable information.
Call in your order at 219-455-6959, DoorDash, Grubhub, or our website, jaysbreakfastclubgary.com.
What a wonderful, wonderful intro to Jay's Breakfast Club. You know, something has been going through my head all morning. Everything must change. Everything must change, but some things must stay the same. So on the third Monday of every month, Doc, we want you to stay the same. Come to Jay's Breakfast Club and share with our citizens of Gary and surrounding areas those things that we need to do to keep our bodies healthy. Oh yeah, wealthy too.
Definitely.
So Dr. Seabrook, it's on you.
Thank you so much, and good morning to you, Miss Rosie.
Good morning, sweetie, and happy birthday.
Oh, thank you so much. Thank you. My birthday was December 6th, but I take the whole month.
I'm sure we do.
And I had a great birthday thus far, and I hope it continues. But I want to say to you, thank you for your continued perseverance in continuing to host Silver Mondays. I think that it has continued to be a light and to help people be able to keep up with what's going on, the new things that are happening at Jay's Breakfast Club, before Jay's Breakfast Club, but then also check in about other things that are going on that are relevant to them and for their health and for their family. So thank you for your continued education.
Thank you.
And again, my praises to you for making this, virtual presentation available as well for our Silver Monday participants who aren't ready to come out of the house yet. So thank you for this opportunity and this platform to be able to do this.
Thank you, Doctor.
So I think we probably want to start the conversation off about what's been on everybody's television screen, and that's vaccines.
Yes.
So for those of you who aren't aware, which I can't believe that there will be many, there are two vaccines that are available right now for COVID-19. Pfizer received the emergency authorization from the CDC to be distributed and to begin to be given to people in the United States. That started to happen. That's been going on for a couple of weeks now. Your local hospitals have those vaccines because they have the freezers that can reach the minus 70 degrees, which is what the vaccine needs to be stored at. So Pfizer is the minus 70 degree storage vaccine. It is a 2-dose vaccine. What does that mean? It means that you get your first dose and you need to come back within 3 weeks to get, or 28 days to get your second dose. Moderna can be stored at regular vaccine temperatures, minus 20 degrees, which is where we can store what we store normal vaccines at. Our everyday vaccines are stored. So that means that eventually health centers will have the regularly stored vaccines like the Moderna type. Moderna is also a 2-dose vaccine, same length of time. You get 1 dose and then you come back within 28 days to get your second dose. And people may ask, if you get Pfizer for your first dose, can you go and get the Moderna for your second dose? The answer is no. Whatever you start out with, that's what you have to complete. So if you start with Pfizer, you end with Pfizer. Start with Moderna, you end with Moderna. And it is very important that people understand that. because the regimen is a 2-dose regimen. It's important that for efficacy's sake and to make sure that the things that need to happen in your body, they're happening with that same medication and not something that might be a little different.
So, Doc, receiving the first, may I use the word injection?
Yes.
Using
vaccine.
Receiving the first injection of the vaccine. Okay, how is that continuity established to make sure that I receive the same company or same, tell me the correct word to use.
Okay, so what you should do is try to go back to the same place that you got it.
Okay.
If you got it at your local hospital, which they aren't doing the public now, but when we get to public vaccines, if you went to your local, say, community health net, when they make it available to fairly qualified health centers, you would try to come back to the place that you got it. Because what we're going to do when we get it is that we're going to store it as it's supposed to be stored. We'll probably only be able to get Moderna because we don't have the storage for the Pfizer vaccine. But if I give Miss Rosie her first dose, your second vial is going to have your name on it. And I'm going to put it back in the freezer. That's your box. That's your medicine. I'm not going to give it to anybody else. So that's why it's so important that you go back to the same place that you received your first dose, because I have your second vial waiting for you.
So that is a tracking mechanism.
Yes, ma'am.
Okay. It's
Yeah.
good to know.
We need people to really cooperate with this. It's going to be very important because we don't want to end up wasting dosages or wasting medications because we decided that we needed to go someplace else that we heard had the Pfizer vaccine, and we know we got Pfizer, so we're going to go to CVS this time. Just try to be consistent.
So with that first dose, are you given the timeline when you should return for the second?
You'll be given an immunization card just like you did when you were little.
Okay.
And it'll have the name brand, the manufacturer, Pfizer or Moderna. It'll have the lot number and all of the information. How much of it you received, which arm you received it in, and then who gave it to you. Yeah, the nurse or the doctor's initials, along with probably a stamp of the hospital or the doctor's office that gave it to you.
Okay.
Yeah, they're being very meticulous with this because of the fact that people have, so many people have lost their lives while we've been waiting for this vaccine to come out. So they're really being very meticulous to make sure the vaccine isn't being wasted. And to my knowledge, there will be no charge for this vaccine at any location throughout the United States.
So it doesn't matter whether you have insurance or not. It's there
in
for
a
you.
public health crisis, it would not make any sense for only insured people to receive the vaccine, and you still have a batch of people without insurance that can't get the vaccine. You still have the public health crisis.
Exactly.
So we just have to blindly give everybody the vaccine that qualifies, meaning that you don't have any contraindications or that your doctor has advised that you don't get it. And I think that those numbers will be small. There will be a small amount of people who have severe allergies, may be asked not to get it at this time, someone who is severely immunocompromised. So there will be conversations that will need to be had because you have to look at each person individually to determine if they should receive the vaccine or not, if they're offered it.
We have any questions coming in?
And something else that I wanted to talk about, I recently did an article about people putting off other health care and their health care needs because of the pandemic, because of this crisis that we are in.
Yeah, I wanted to get to that.
Yeah,
but first of all, I just wanted to try to see if there were any additional questions because I think it's very, very important. You have really stated some very pertinent kinds of things that we need to know. First of all, that no, you don't have, there's no charge, there's no cost. And that's very important in our community to know that it's there for you. But you've got to take that first step. You've got to go. When your time comes, when that timeline has been set up. And I did hear last night that they are about to move to the second group.
Yes.
Can you-
So it's been divided up, and so group one was all hospital employees that wanted and were willing to take it. And this is from the physicians in the ER and on the floors to the people in facilities and ground maintenance to help keep the hospital going. So it's everybody in between that works at a hospital. If your hospital has it and you want it, you should be able to get it. So that was one. Also included under one was nursing homes and VA facilities, because you want to make sure that we protect our most vulnerable. Now we're getting ready to move into 1A and 1B. And so in 1A and B, they'll start to spread out into other healthcare facilities with vulnerable populations. Also looking at people age 75 and up that are in those facilities that are most vulnerable. So as I said before, it is going to be a very measured and carefully staged rollout, because we don't want to waste any vaccines. And again, and I look in the camera and say this: if someone is trying to charge you for it, be very cautious, because there should not be any charge for this vaccine. So if someone is trying to charge you, be very careful. Now, some facilities, and we're still waiting to hear from the federal government and from our state, because state governments run the Medicaid program. We're still waiting to see if they will allow the doctors and nurses throughout the United States who are in private and public facilities to charge an administrative fee. And so that fee might be anywhere from $8 to $15, but I can't speak to that. But if anyone is talking about charging you hundreds or thousands of dollars to get the vaccine, be very mindful, be very careful, and actually I would dissuade you from taking any medication, particularly this vaccine, if someone is asking you for an exorbitant amount of cash up front or to utilize your credit card.
So make sure we're separating the administrative fee that could possibly be charged. Separate that from someone charging you for the medication itself or for the vaccine itself.
Yes, this is correct, because what we want to make sure is that people understand that if someone does ask you for your insurance card, that the reason why they're doing that is because if we're able to get an administrative fee, then we would only bill that. We would only bill that administrative fee. You should not see anything else, any other charges on your insurance card if you have insurance.
Okay. Chelsea.
Dr. Seabrook, can you talk a little bit more about what happens or what could potentially happen if you don't return for the second dose?
So just like with any other vaccine, you may have to start over again, and you have wasted a dose of medication. People will not be happy. Now we understand that there are circumstances. You may fall ill with something else. You may be in the hospital. You may be out of town. I would reach out to your healthcare provider that gave you the first vaccine and say, whatever the circumstance is, what can be done. If you're in a local hospital, they may be able to have it overnighted to where you are so that the people in the hospital can administer it to you. So there are ways to get you your vaccine. So, but just be very mindful. Keep that date circled on your calendar. The date that they give you, keep that circled and try, to do everything that you can to make sure you get back to get it. But if you don't, reach out to your healthcare provider and let them know the circumstance, because like I said, they may be charged for it, but they may be able to drop it in a FedEx envelope and send it to you wherever you are. But it's very important. That's your dose, and you need to get it.
Now that we have the vaccine, where does testing fit into this?
So that is an excellent question. So there's still a need for tests. That has not disappeared. That will not disappear, because right now we don't have the vaccine. Okay, it isn't widely available. And so I am letting people know that there will still be a need for testing until more of the general public has been vaccinated. So I still see that we'll probably be doing curbside testing and COVID testing till all through next year, until the general public, at least 70, 75, 80% of the population is vaccinated in your area. When you think about the universe of the United States, we need to get at least 80%, but then also in your community that you're in, we need that 75 to 80% people getting the vaccine. So that reduces the chance of the spread of COVID. But we'll still be testing for a while because the general public has not been vaccinated fully yet. But that was an excellent question.
How often is testing recommended?
So you shouldn't do testing for testing's sake. Now, if you're someone that is at home and you do not have to go out, and you're only going out to the grocery store or pharmacy, and now those things are being delivered so you can actually do that, there's no need for you, and you aren't having people coming into your house that don't live with you, there's no need for you to get tested. If you are out and about in the community, you're an essential worker, you have to work, you're showing symptoms, you need to get tested. So if you aren't being exposed, because we really want to save these tests for people who are out and about, say essential workers here at Jay's Breakfast Club. I want Jocelyn to be able to get herself and her staff tested to make sure that they can stay here and run the business. So those are some examples of who should be tested in my staff, people who are on the front lines at hospitals and at the grocery store. When they become symptomatic, we need to know. They need to quarantine, be tested, contact trace, all of those things so we can find out everyone that they came in contact with. So I'm not dissuading people from getting tested, but reserve the test for people who are being exposed on a daily basis and not just because I want to know.
Dr. Seabrook, can you talk about the COVID testing that Community Health Net is offering?
So Community Health Net for the past almost 2 months has been offering curbside testing. And what does that mean? It means that it's actually literally curbside. And so you pull up and you let us know that you're outside, and we come out, we do the swabs, and we go back inside, and then we let you know within 24 to 48 hours your status. However, we have the rapid test, and typically when somebody is positive, as soon as that swab is dropped, it pops up like a pregnancy test. So we could quite possibly tell you within 40 to 50 minutes, but we typically tell people to give us at least 24 to 48 hours to receive your results, but we've been actually giving the results faster than that. There's a number that you should call first, because we're asking people to not just show up. Okay, so if you call the office line, 219-880-1190, they will connect you to our COVID testing hotline. And people on staff will answer that phone, COVID testing hotline, and they will give you an appointment. And typically it's the same day, and you can drive right up and get tested. But we need to know you're coming, because we've had some incidents where people who thought they were positive and they wanted to walk into the office to ask about the testing. Well, that puts everybody at risk. So I'm asking you, please call 219-880-1190, and they will put you over to the hotline. But we do have a direct number too, 866-283-7819. 866-283-7819. That is the curbside COVID testing hotline. If you call that number, someone that works at Community Health Net will pick up the phone and give you instructions on how to do curbside testing.
So is that at all of your sites or at specific sites?
So right now we're at Martin Luther King, but we're in the process of setting up at other locations. We did a pilot for the last 2 months at our Martin Luther King location. It has taken off like a rocket. And so now we're ready to roll it out to our 1021 West 5th Avenue location, our 6100 Broadway location, and a couple of other locations. But we're trying to do it very systematically, and as we do that rollout, then we'll make the general public aware. Yeah, we wanted to have some control over. We just didn't want all of the offices being bombarded with people requesting COVID testing. But we do have analyzers at more locations than just the Martin Luther King location.
With all of this information, Chelsea, let's give the Community Health Net a commercial here.
Community Health Net has 6 locations in Northwest Indiana. Dr. Janice Seabrook is the owner, operator, founder, dream maker of this organization. And not only are the COVID tests offered, but a variety of services, everything from prenatal care, optometry. We recently added dental care as well. So we also ask that if you'd like more information, to call that same number, 219-880-1190, or visit our website, which is www.chn-indiana.org.
Thank you. And are there questions coming in now?
Paulette Williams said, "Happy birthday, Sagittarius."
Yeah.
Happy birthday, fellow Sagittarian. Okay.
Art Sims said hello.
Doc Chat Daddy.
Yes.
Okay.
And Thomas C. Sanders is currently watching.
And you have quite a few watchers here on Jay's Breakfast Club. Dr. Seabrook, can you speak to the connection and importance of flu shots in regards to COVID-19 and why it's important to get your flu shot?
So that's an excellent question. And what we have experienced, and you know how people typically during flu season start pushing back. I'm not getting that, I don't want that. This has been one of the lowest incidents of flu in the United States history because, and scientists like Dr. Fauci and some of the others at NIH and at CDC believe it's because we were so many months into practicing social distancing, the hand washing, wearing the mask, that they have actually helped us to reduce the incidence of flu in the United States. So, you know, people, you know, there are positives and negatives to everything. Very negative, how many people we have lost because of COVID, but because of the measures that we put in place, the social distancing, the hand washing, the wearing of the mask consistently when we're out in public, has literally prevented the spread of the flu, the influenza that happens. Typically, it would be raging by now because it happens when people come home, Thanksgiving, Christmas, New Year's. You know, people are traveling, going on vacations, and so we get a mix of all of these various influenzas that are coming, European, you know, Caribbean, and in the U.S. we travel over there. And so this, even though in the midst of this tragedy, in the midst of this pandemic, we have not lost. Typically, we lose anywhere from 65 to 80,000 people of influenza every year, and that's just in the United States.
Wow. So we have a learned lesson from all that we've gone through. Even though we complain about the mask and all of this, and I can't hug you like I like to hug you, we have some learned lessons through this entire process.
We have, certainly have, and also something I wanted to make sure people understand. Yes, we have a vaccine. Yes, it will be offered to the general public, but no, you can't take your mask off. We're still going to be wearing masks in 2021. You're still going to be wearing your mask after you get vaccinated. That is very important for people to understand that. You're not going to get the vaccine in your arm and then go rip your mask off. That's not how it works, okay? We're going to be wearing these masks for a while. I'm actually going to continue wearing mine well into 2021.
And maybe 22.
Yes.
Okay, we can move on now unless we have another question.
We have one other question that we'd like Dr. Seabrook to speak to, and that's the travel advisory during the remainder of the holiday season. Can you give your medical advice on that as the airports continually get packed for Christmas and New Year's?
I know this has been a difficult time. People didn't heed for Thanksgiving, and now we're reaping the repercussions of Thanksgiving visits and trips and holidays and things like that. And I know people are sounding, in the healthcare field, are sounding like broken records, but it's going to happen again. If we do what we did for Thanksgiving, which was not keep ourselves within our family unit and only have Thanksgiving and Christmas dinner with people that you know that have been in your pod with you, And we didn't do that. We didn't practice that, and now we're reaping the repercussions of that. And it is my fear that the same thing is going to happen again for Christmas, which is, just a few short days away. We're going to experience the same thing because there are going to be people who are just not going to believe that it's not going to happen to them. And unfortunately, I personally know, not my family, but I know of other people's families that continue to gather during Thanksgiving, and multiple family members have COVID now.
Lessons learned.
One last bright spot that I'd love for you to react to regarding the pandemic. Over the weekend, we saw in the news that there is a large spike in applications to med school as a result of the pandemic. What do you think about that, Dr. Seabrook?
When I found, and this was the general public's first time hearing about it, but we knew about it when it started to happen. And so this is something that is literally, medical school applications have literally been on the rise for the last 3 or 4 years. But this year was unprecedented, the number of people, and I'm hoping that some of that was stimulated by the, Bloomberg gave a very large donation. Bloomberg gave a very large donation to 4 of the historically black medical schools throughout the United States, and so I'm just literally so excited about more students' ability to not only apply, but not be so burdened with debt coming out of medical school. So I'm elated, I'm ecstatic, that was great news, and I'm glad that more of the general public is aware of it. So, it may not be in the next 3 to 4 years, but at least in the next 6 to 7 years, we should start to reap the benefits of all of those incoming doctors finishing up their residency programs and then going out into their communities to begin to practice medicine.
So I'm going to take a step back. Last week was Garrett Community School Corporation Day here at Jay's Breakfast Club. This is an excellent opportunity for our career center and those kinds of places to really start getting our young people while they're still in school to understand how important the medical profession is. Doctor, do you have any partnerships with any of our schools? And I know the answer, I'm just asking.
Why yes, Miss Rosie, we certainly do.
Okay.
We are part of the GAPS program and the career program, and what has the Career Pathways program. So what we've done with that is, it's been virtual right now, but we've had a lot of good response. We're trying to look at a virtual tour of the health center, virtual conversations with not just the medical doctors and the nurses, but with our health IT and information specialists, with our data analysts. Actually, one of the best responses, I was not able to make one of the virtual events, so our IT consultant went and sat in, and there were about 19 kids on this virtual presentation, and they bombarded him. Several of them have contacted him after, so there's a lot of interest, not only as being a doctor or a nurse or a medical assistant, but literally working in the healthcare field. Because it runs the gambit, radiology, you can be a technician in radiology. Now we have dental hygienist and a dentist in our health center. We have an optician. So, it's not just a medical doctor. The medical field, particularly inside of Community Health Net, runs the gambit, and you can see people who look like you doing a myriad of things that help to operate and keep a facility open every day.
So, Doc, as we get into the new year on third Mondays, let's start highlighting some of those other things that's happening in your wonderful facilities.
We certainly can do that. We can look at bringing in our optician. We can look at bringing in the dentist or the dental hygienist. And what I like to try to encourage children to do that don't necessarily know what career pathway they want to go in, to find something that could help you keep a roof over your head and money in your pocket until you figure that out. And that might be being a medical assistant. It may be being a dental hygienist or a radiology technician, because those are career pathways that lead to, better benefits, higher income, but then they start out at a nice salary as well in those positions. So I like to talk to students about thinking outside of the box. So you may not necessarily know what you want to do, but let's find a pathway to help you get there. But let's not just say, well, I'm not going to work or do anything until I'm able to get that position. Let's look at some entry-level positions that can give you the income that you need to help you fulfill your dreams.
You have to have a foundation before you can build that house, right?
Yes, exactly.
Do we have other questions?
I have one question. Over the weekend, Dr. Fossey talked about the African-American woman that discovered one of the vaccines. Which vaccine was that, and are you familiar with who she is?
Yeah, her name is, she's a PhD doctor, immunologist, virologist, and she's Dr. Kizzy is what I call her. Our good friend, Dr. Corey Bear, says that he has met her, and we're just real excited. I literally have a picture of her on my phone. I literally have a picture of her. Yeah, a fangirl moment.
So would this be like Wakanda and the Black Panther's sister being the smartest woman in America? You know which company her vaccine is, or is?
I'm not sure. I would have to look into that and get back with you on that. But we're just super proud that somebody who looks like us has been, on top of this and been, boots on the ground since COVID-19 hit our shores.
We're proud, but we're not surprised. How many folk like us have been in the forefront of a lot of things that have happened?
Yeah, so, and basically not been able to be heard about the work and recognized for the work that has been done.
So we're pleased and very proud that he did mention and really put it out there. And that's another reason that our young people can say, I can do this.
I think another reason why that might have been done, and I can't speak for Dr. Fauci, but I think that in some ways he was trying to instill confidence in the Black and brown community about the confidence level in the vaccine and some of the pushback that people were given and some of the vaccine resistance. And I think that he wanted to make that known so people would then begin to do their research about her, find out more about her and the work that she's been doing in the vaccine community for years. And I believe that that was one thing that Dr. Fauci wanted to do, to make sure that people understood that everybody didn't look like him that was working on the vaccine, and the people that look like us that were working on the vaccine.
And in that vein, Dr. Seabrook, can you, once more and more people are tuning in, talk about the apprehension, talk about getting educated before you just write off the vaccine, and how we have this hesitation because of things that have happened historically around African American communities being duped, if you will, into dangerous situations, and what's different about this in 2020 versus decades ago?
So I think that one thing, so we talk a lot about social media and how it, can enhance things or cause things to be a detriment. It can be a detriment. And so I think that if we look at things that happened hundreds of years ago, where there was very slow communication and education about things that were going on, versus now we have this education at our fingertips to be able to do the research on our own. And I ask people, please go to reputable websites. Get off of Facebook. Don't click on those links on Facebook if it's, ABC, yada, 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 medical. No, don't do that. Go to reputable sources, the CDC, NIH, Pfizer's website, Moderna's website, any type of any of the vaccine companies. Go to their websites, find out more. Look at who their doctors are, who the researchers are, get all the information and education that you need. But I think that it's because we do have so much information out there, people have to be more responsible and start to drill down on what is best for them. Now, I do need to say that we need to really consider taking this vaccine. Educate yourself, but you should consider taking this vaccine. We're going to find out sometime when another administration gets in and investigations are done that a lot of black and brown people have died of this disease and we don't know about it. When we find out what's actually in those 318,000 people that have died so far, when we find that number out, we're not going to like it. So I'm going to advise people, if you can and if it's offered, you need to get it.
Wow, you know, they said time flies when you're having fun. Well, time has really flown this morning because we were having fun getting some good information, some very pertinent information that we all need to know, live, and all of those other things. And I know, Doc, you wanted to talk about these other things that we need to get involved with, but how's our time?
About 2 minutes.
Can you tell us in 2 minutes?
I can try.
Okay.
So one of the things that Ms. Rosie is talking about that I shared in some of the articles that I've been doing is asking people who have chronic diseases and chronic disorders such as hypertension, diabetes, people who need outpatient treatments such as hip replacements, shoulder replacements, if you are someone that's living with HIV, do not delay your health care. Pick up the phone, call your healthcare provider, call the hospital that you're going to have that elective procedure or that outpatient surgery center. Find out what steps and measures that they have put in place to keep people safe while they're at their facility. Find it out from your doctor's office, find it out from the urgent care center, find it out from the hospital or the surgery center. What steps, what measures have you put in place to help keep me and my family members that are coming with me safe? What measures are we asked to wear masks? If I don't have one, do you have one available? Is there hand sanitizer? Are we social distancing? How many people are allowed in the facility at the same time? Are there sanitizing stations? There are so many questions that you should ask. And once they're answered and those answers meet your standards, then you should go to your doctor's office and have whatever procedure that you need to have done, have whatever office visit that you need to have, and go to the surgery center or to the hospital and have whatever elective procedure. If that hospital or surgery center is still doing elective procedures. Call first, educate yourself, find out the measures and the steps they're doing to keep you safe.
Well, once again, this has been a wonderful, wonderful morning. And I could apologize for the background noises that you've been hearing, but I will not. Because where are we, Chelsea?
We are at Jay's Breakfast Club, 3669 Broadway in beautiful Gary, Indiana, in the Glen Park section, University Park. We ask that you continue to support this wonderful small business by ordering online, dine in, or carry out. Visit the website for the full information for menu, costs, and more. www.jaysbreakfastclubgary.com. Coming in January 2021, Beyond Meat vegan offerings. For those of you who are looking to jumpstart the year for healthy lifestyles, follow our page for more information. And that healthy menu is dedicated to you, Dr. Janet Seabrook.
For more information about Community Health Net, call 219-880-1190 or visit our website, www.chen-indiana.org.
And Doc, you might want to let them know to tune into your Facebook page so that you can let them know about that vaccine discussion you had the other day.
Yes, please tune in to my Facebook page, Dr. Janet Seabrook, at Facebook, where I have engaged Dr. Corey Adair and Dr. Simmons about the two different vaccines from Pfizer and from Moderna. So for more information, just tune in to Facebook.
Okay. Thank you, and what a wonderful morning. got, how can we thank you? There are not enough words. So I'll just simply say thank you for being here with us today. And we look forward to seeing you in January 2021. Can you believe that? Cannot believe it, but it's almost here. And we say to everyone, please have a very Merry Christmas, a very safe holiday with your loved ones. My family will be Zooming. What about your family?